in the chat. I'm going to pass things over to Michael to give his presentation. Take your full time, Michael. We can make up some time later on in the agenda when we do kind of federal, state, local updates.
Okay.
All right.
Sounds good. All right. Again, I'm Michael Grandy with Kimley Horn. I'm the consultant project manager for the Arizona Strategic Highway Safety Plan. And with me is Steve Nair from ADOT, who's the SHSP project manager. We appreciate the opportunity to come and talk to you today. We're going to give you a quick overview of the SHSP as well as the ATSAP, which stands for Active Transportation Safety Action Plan, and then talk about some of the vulnerable road user emphasis area strategies that came out of that effort. And by vulnerable road users, we are referring to pedestrians and bicyclists. And then wanted to give you all an opportunity to talk about some potential ideas you have for actions to implement some of these strategies. And we'll go over next steps for the project. So the SHSP is a policy document ADOT's required to develop every 5 years about how to reduce fatalities and serious injuries on Arizona roadways. This applies to all roads, not just the state highway system, but local roads as well. This was finalized in October of last year and developed in coordination with the Active Transportation Safety Action Plan. You can access this document plus some of the supporting documents at the web link here, the azdot.gov/safety plan. The Active Transportation Safety Action Plan is a document that was done at the same time as that SHSP, and it builds on the previously completed pedestrian safety action plan and bicyclist safety action plan that were done back in 2017. And then also on the vulnerable road user safety assessment, which is now a required component of an SHSP. This was done in advance of the SHSP and completed in November 2023 and is an appendix of that SHSP. And part of that, the ATSAP is, or main part of it is developing specific projects. So this is different from the SHSP, which is more policy-based. The ATSAP is specific projects and costs for pedestrian bicyclist improvements, but this one does focus on the state highway system only. And so where a lot of those needs are where the local roads intersect with those state highway system facilities. And the ATSAP is one of the things that those recommendations are being looked at as part of the SHSP implementation. And again, that's on that same website, azdot.gov safety plan. You can find those documents as well. So both Michael? The SHSP and the ATSAP. Michael? Yeah, go ahead.
Sorry, that's one question I get a lot. So do you mind just clarifying that again? The ATSAP versus the SHSP, which one focuses on state highway system roads and which one is kind of broader?
The ATSAP is state highway system only, and the SHSP is all roads.
And then the ATSAP project specific, the SHSP is a policy document.
Correct.
Okay. Yeah. Perfect. Thank you.
Yeah. And please, if anybody else has questions, feel free to stop me as we go along here. But both the SHSP and the ATSAP utilize the safe system approach, which some of you may have heard before. For others, it may be a new phrase. But this is what the Federal Highway Administration is kind of going with as a little bit of a paradigm shift from what we've done in the past. Instead of let's try to eliminate all crashes, because that's just not realistic. It's now how do we reduce the likelihood of crashes and then minimize the harm caused to those involved when crashes do occur. And it focuses on eliminating fatal and serious injuries, more so than just all types of crashes. So there's 6 safe system principles, and this wheel image on the right, these are what's on the outside of that. And then 5 safe system elements are like the wedges inside. So, basically what this is, safe system approach says, it's unacceptable that people are dying and being seriously injured when they're traveling on the transportation system. But we recognize humans make mistakes. Humans are also vulnerable to like impact forces. We all have a responsibility to be proactive in trying to minimize the likelihood of crashes, and then when there is a crash, the severity of that crash. And you do that through developing a redundant transportation system. And then the 5 elements: safe vehicles, safe speeds, safe roads, post-crash care, and safe road users. All 5 of those are important and they work together. They're not like siloed things. When we talk about safe vehicles, that's like things inside the vehicle, like seat belts, lane departure warning systems, and things like that help make the vehicles themselves safer for occupants or for whatever they may run into. Safe speeds is trying to encourage people to drive speed that's appropriate for the facility and the context around that. Safe roads are the facilities themselves, so that would include not only like paved roads, but also like trails, sidewalks are also part of that safe roads component. Post-crash care, when a crash does happen, what do we do to keep the crash scene safe so there aren't secondary crashes? And also, how do we get people more quickly to the medical help that they need? And then even once they're at like a hospital or other medical facility, are there things that can be done to decrease the likelihood that someone might pass away or have long-lasting impacts from a crash? And then on the safe road users, that's the people side of it. So that would be drivers, walking, biking, micromobility devices, transit riders, and what role do they have in trying to improve safety in terms of being aware, wearing physical clothing, not being distracted on their phone? Those kinds of things are all important components of the safe system approach. Are there any questions on this?
Well, we were just Michael dropping in the chat also about safe vehicles from NHTSA on some of the changes to just the size of vehicles have become very bloated and obese, and it's harder for people to survive even low speed limits if they are hit as pedestrians. So we were just dropping that in the chat to include in that component that you're sharing.
Okay, great, thank you. Yes, that's definitely one of the pieces of safe vehicles. Vehicles have gotten larger over time, and that's not helping pedestrian and bicyclist survival rates. All right, so the SHSP has 5 different emphasis areas, and these were developed based off where the majority of the fatal crashes were happening. So human behavior, vulnerable road users, intersections, lane departure, and tribal lands. And these emphasis areas help us kind of focus where we need to prioritize, making changes to policies and to make it more likely that road safety will be improved and reduce the likelihood of fatal crashes. And your group is probably most interested in this light blue box, the vulnerable road users, which constitutes 25% of the fatalities in Arizona, which is a sobering fact. So for those SHSP emphasis areas, we developed individual strategies that could help, that are organized by the 5 state system elements that we just talked about. So those are the columns here. The rows are the different emphasis areas. And so in the SHSP appendix, there's all 80 of those document or strategies are documented there. But something we're doing different this time on the SHSP compared to what ADOT's done in the past is they're keeping Kimley Horn on not only for the development, but also help with implementation. So it's not hopefully a plan that just sits on the shelf with some good strategies, but can actually move into action. And to do this, there's an executive committee that consists of high-level management from several of the state agencies. For example, the Department of Transportation, the director, Director Toth, is on that committee. Department of Public Safety, Department of Health and Services, Economic Security, a couple others I'm missing, and then also from the tribal side, we have representation from the Intertribal Council of Arizona, which represents most of the tribes in Arizona. There's an SHSP administrator, that's Steve Nair, the SHSP project manager, as I mentioned earlier. And then we are actually have developed teams to focus on each of the 5 emphasis areas, which are these 5 here, as well as we have a team focusing on safety data sharing. And then ITCA is helping us with the tribal safety planning focus. And then we also coordinate with the regional and local safety planning efforts as they are developing their own documents, make sure they're aware of what is in the SHSP and encouraging them to incorporate that into their planning efforts. So some of the activities that we've already started undertaking, as I mentioned, we've developed some emphasis area teams. We have invited agencies, tribes, any interested stakeholders to be part of any or all of those SHSP emphasis area teams. They meet virtually quarterly, and it's intended to be a 5-year commitment, which is when the next SHSP would be updated. Anyone can participate that wants to, and the intent of those is to how to develop action plans for those 80 strategies I mentioned earlier, and then track and evaluate outputs and outcomes as some of those strategies are implemented. And what are we seeing in terms of crash statistics? Yes, but also in terms of process changes, the way agencies are doing things. Maybe changes in their standards, like that we can say these will help in the future. It may take several years to kind of see the full effect of those. We want to kind of track those outcomes and then refine strategies moving forward as needed, and then just advocating for implementation of those strategies wherever we can, including like this meeting here. This is what we're doing, advocating to get your help to advocate for implementing those strategies through your circles of influence. So I'm going to focus now on the vulnerable road user emphasis area and the strategies that were developed for that. First off, kind of snapshot of how we came up with the vulnerable road user being an emphasis area. These are a few statistics that kind of show what's going on. Again, I mentioned 25% of all fatalities are pedestrians and bicyclists, but compare that to only 4% of all crashes involve pedestrians and bicyclists. So there's a big discrepancy in 4% of all crashes, but 25% of fatal and serious injury crashes. So it's something that, because pedestrians and bicyclists don't walk around with bumpers, when they do get hit, it creates a big impact on them, on their bodies, with the force from vehicles. And generally, pedestrian fatalities have doubled in the last 10 years. Serious injuries are generally up a little bit, but not as bad of a trend as the fatalities. Bicyclists, the serious injuries have actually generally gone down the last 10 years, but fatalities have increased. A lot of pedestrian bicyclist fatalities are happening as people are trying to cross the road. Some of those are at intersections, some of them are mid-block. Most of them are during the day for bicyclists, but at night, that's when we're seeing a lot of the pedestrian fatalities that are happening. So these are the strategies that were developed for the vulnerable road user emphasis areas, with, again, organized by those 5 safe system elements. The ones in bold are the ones that were determined, identified to be high priority ones. So under safe roads, we have 4 strategies. We separate the VRUs from vehicles using space and time. So that's, like with a vertical curb or some kind of barrier between where the pedestrians and bicyclists are and where the vehicles are. Or by time, we mean like at a traffic light, having a walk and do not walk, things that assigns a time to the pedestrians and bicyclists. They're not having to just start across the road. Second one's improve the visibility of vulnerable road users. So that could be with the people themselves that are walking and crossing, but also with lighting, things, or bulb outs and things to make sure drivers are seeing the pedestrians and bicyclists. Third one is enhancing connectivity. So that's making sure there are facilities that connect to each other, from point to point. There's not gaps, including the crossings of streets. And then the last one under safe roads is incorporating more prominently in planning and design and programming processes, VRUs, making sure that they're part of that decision making process all along. They're being accounted for instead of an afterthought afterwards. Oh, what are we going to do about that? From a safe road user's perspective, most of these relate to like education and enforcement type things, of helping people understand the risks that are out there and how to be a safe pedestrian, how to be a safe bicyclist, but then as a driver, also how to be aware and look for pedestrians and bicyclists. And then making sure everyone understands the laws that are there. And right now there's a lot of confusion on e-bikes. You may have seen a few in your neighborhood. Some of them are going very fast, and it's not always clear, are they supposed to be in the bike lane? Are they supposed to be on the sidewalk? Are they supposed to be in the travel lane? And some of the laws are, that were made a long time ago, maybe didn't quite anticipate what we have today in terms of what e-bikes are like. So that's an area we'd like to see some policy changes and legislation changes. Safe speeds, this relates to, again, enforcement of the laws and policies for electric and micromobility devices in particular, but then also utilizing context appropriate speed limits. There was a change recently in the federal guidelines on setting speed limits, and now the guidance is to look at context, not just the 85th percentile of what people are driving. So there's more opportunity now to get agencies to potentially lower speed limits in areas that have high pedestrian bicyclist activity or lots of driveways, areas that it may make more sense to have a lower speed limit. And then safe vehicles. This is not, a lot of this is not in the hands of ADOT or the local agencies to actually implement these, but they can still advocate for early implementation of automated detection by vehicles, and with the vehicle manufacturing companies, getting them to incorporate that into more vehicles more quickly. And then, as was mentioned by Nicole, about the larger size vehicles, supporting programs that incentivize lower weight and lower height vehicles. On the post-crash care, we're looking at, how do we promote safety at crash scenes, and then improving the sharing and collection of data so that we get a better, more accurate picture of what's really going on with crash and trauma for VRUs, because a lot of VRU crashes are not reported or not accurately reported of like what really happened and what's going on. A lot of people, refuse treatment and things, so sometimes it's hard to understand what's really happening. And then last is sharing a lot of that data with VRU advocacy groups such as yourselves, making sure you have the data that you need, so then you can advocate for pedestrians and bicyclists. So those are the strategies. The ones I think that many of you may be able to impact the most are in that safe road element component. So that's these 4 here that we talked about initially. So definitely we'll give you an opportunity here in just a minute to provide some thoughts on those. But each of those 80 strategies, as I mentioned, is in the SHSP, and in the appendix, there's a more detailed table for each of those 80. And these are the detailed tables for those 4 safe road ones out of Appendix A of the SHSP. So these just give a little more background on what the description is for that strategy and give some examples of potential actions that could help. I had already mentioned some of these and kind of explaining things, but then also talks about, who might be a good stakeholder lead to implement this, what's the time frame and the cost level, and how do we measure that, and where might funding come to implement some of these. On the visibility, lighting, static warning signs, flashing beacons, bulb outs, and then in work zones, making sure people are using reflective gear, appropriate traffic control devices, and physical barriers to improve worker and responder safety, because they also fit under that vulnerable road user as a construction worker walking around, a job site on the side of a road. That fits under that VRU umbrella. And the other 2 safe roads ones are enhancing the connectivity. And then the last one, the incorporating VRUs more prominently in the process. So a lot of that is dealing with policies, guidelines, standards, these kinds of things that can be implemented to make sure pedestrians and bicyclists have a safe way to travel. I did want to talk a little bit about the prior emphasis area team meetings for the vulnerable road user emphasis area that we have had. So we're about 3/4 of the way through the first year of implementation. So we've had 3 meetings. They're held quarterly. Talked about the roles and responsibilities of the emphasis area team, and that vulnerable road user emphasis area team right now, I'm trying to remember, but I think there's 40 or 50 people part of it. It's a pretty good sized team. I think it's the largest team that we have of the emphasis areas. So a lot of people are very passionate about pedestrian and bicyclist safety. We have elected a chair and a vice chair from the volunteers on that team. We've reviewed the emphasis area strategies like what I just did. We've done that with the whole emphasis area team. We've reviewed the action tracker tool that Kimley Horn's developed to help us kind of keep track of everything. We've had some breakout sessions to brainstorm potential actions. And I'll have Steve kind of mention a few of the ones that were talked about at the last meeting. Steve, you want to go ahead and do that?
Yeah. So thank you, Kenneth, for sharing it in the chat so people can kind of look at it. but it was kind of great way. And I see some people are typing up even more, and that's great. That's really encouraged and needed. But just it's helped us kind of brainstorm ideas that everybody can use. So some of the ones that are options are considering Idaho stops at intersections that could help. And that would have to go through legislation, I think, with like local or even with state, your state governments. There's the bike bus routes, which I heard Nicole mention, which I also agree could be very, very helpful. And an unorthodox one that I suggested, I saw this on TikTok, I don't know how long ago, but at some intersections, they had a stand with foam bricks that people were holding as they were crossing the street to look threatening to drivers. And they said that it helped. So, these are just some ways to find unorthodox or different, ideas to help implement some of these changes. I know another one that I didn't post, but I think is good to consider. There are other states that are passing legislation against what is called, I think it's called a Carolina squat, where lifted trucks are lifting themselves in a way where the front is higher than the rear, and it's making it worse for them to see potential pedestrians and bicyclists. And so states like Mississippi and Tennessee have already passed bills banning the Carolina squat. I don't think we have that problem in Arizona, but it's something to consider as well. So any and all input and ideas are welcome. And the SHSP groups, the EA teams are a great way to find and to connect with people to see who we need to reach out to in regards to implementing some of these strategies, whether that be with your local government, with your state government, or so on. So those are some of the ideas that we have come up with in the last EA meeting.
Thanks, Steve. Yeah, and as you're having ideas, yeah, feel free to drop those in the chat or kind of talk about them in a minute here. But we do also do some like mini presentations as part of those EAT meetings. So people become more educated on what is out there. Had Elaine Mariel talk about the Transportation Alternatives Program, the ADOT Share the Road Guide, and the ADOT's looking to update that. And then just to make you aware, there is a traffic safety education campaign that ADOT is currently working on, and we're making sure that pedestrians and bicyclists are one of the focuses of that. There'll be some other things too. We want to make sure that those messages are getting out to people. So if you'd like to be part of the Vulnerable Road User Emphasis Area team or any of the other EA teams, just let me know. I can get you signed up on the roster. Some of you are already part of it. Appreciate that and your participation in that. Yeah, I see we have some questions.
Yeah, thank you so much, Michael. Thank you, Stephen. Really appreciate y'all being here and going through the plan, encouraging folks to join the process. I saw Eileen, your hand was up. You still have a question?
Yeah, well, I just wanted to mention, I don't know if you guys have seen the Arizona State Parks Plan, the SCORP, because they have one of the top things that the Arizonans want to see is more pathways to health and wellness. So that's like such a great resource to reference, maybe with some work you're doing. And then also, I'm seeing a lot of opportunity and talking to folks with trails about how, well, trails can provide good access for firefighters, same thing with pathways, but pathways can serve as fire breaks and also provide improved access. Like there's a road up here in the North Valley where it's pretty narrow, 2 lanes, so fire break could, pathway could really help them not have to close the road if there was an emergency. So very important for rural communities. And then also I talked to Arizona Department of Forestry and Fire Management, and they really like the idea of more pathways because it creates more smaller quadrants, and then they can do prescribed burns, and they essentially have a safer area for their firefighters. better anchor and defense points. So just something to kind of in rural areas to consider. I don't know if that's come up much.
No, it hasn't, but I think it's a great point. Thanks for sharing that. And
Nicole?
Yeah, and I'm going to drop this also in the chat to one of the questions I had was about, and I understand there's not an answer yet, Stephen, but if maybe in the future we can have this as an action item to come back on it, are speed inhibitor devices. I didn't see that here in the presentation, and nor would it be like a main topic, I understand, but just as a tool in the toolbox of how to improve our street, road, highway safety would be implementation of policy like that. Because this past session, we had a Republican from Prescott area sponsor a bill for speed inhibitor devices, and it failed by the Dems. And in other states, it's passing because of Dems. And so what this is and I dropped a little bit in the chat, speed inhibitor devices limit your speed and it could be implemented in any way that a state deems appropriate. An example would be for recidivist speeders, or even a one-time speeder potentially who's going like 30 over, like criminal speeds. The law could say where a judge has discretion and, or, maybe there's a threshold to where, regardless of what a situation is, that person just has to have a speed inhibitor device put into their vehicle for a certain time frame. Could be anything, 30 days to a year. So I just wanted people to understand that, because that came to council, the state this year in the House, and it failed. And my connections, the representatives told me that ADOT had concerns about it. And so that would be great to know and understand, because we want to be a leader and we want any kind of tools possible to help improve our streets and safety. And then also there's chats about e-mobility devices. This is something I have a lot of experience with, being a person of a family of 4. We all get around on e-bikes. So I think there's concerns too with all the different cities. They have different age limitations. I actually fought really hard to get them lowered in Phoenix because of our extreme heats, and not a lot of kids have mom and dads to rely on. And also, I'll leave it at this: when we become 16, we could qualify to drive a 2-ton pickup truck, and suddenly we think at 16 we metamorph into like some great driver. So my perspective is that usually younger kids are actually more responsible even than young adults. So give them the chance to learn how to e-scooter and e-bike around, because it's hot, Anyways, I just wanted to leave it at that, because I'm really apprehensive about restrictions that could impact vulnerable communities who depend or are becoming to depend on e-mobility devices.
thanks for sharing that, Nicole.
Yeah, we encourage all of you. We know how busy everyone is, day jobs, volunteer roles, all kinds of things y'all have going on, but these emphasis area work groups are a good opportunity to engage. I welcome you personally to the vulnerable road user emphasis area as one of the vice chairs. But as we can see through the conversation that we've had today, that other emphasis areas are also important to us, and some of the issues that we're working on.
And I did send the slides of this presentation to Kenneth, and he added them to the shared document. So I was just going to show you, here are the contact info for the chair and the vice chairs. And then also, here's my contact information and Steve's contact information.
Thanks, Michael, for sending those. They've been uploaded to the AALC Google Drive. So just go to the monthly meetings folder and go to July 2025, and those slides will remain there. I think we're also going to post just this section of the meeting, the presentation and the discussion, to our AALC YouTube channel. So if you need to share this with anyone, you can do that once it's uploaded as well. All right, thanks again.
Yeah, no problem.